Hi, welcome to our presentation. We are from Group 6 and we will present to you methods to prevent rabies infection. For your information, rabies is one of the diseases that is getting worse day by day. The common risk that occurs when someone is infected by rabies virus is the risk of death. This is because this risk started after someone was bitten by an animal that has the tendency to transmit the virus to humans. And for those who have rabies, may suffer from some symptoms include a fever, headache, hallucinations, trouble sleeping, confusion, and hydrophobia. Besides, rabies will attack a brain area that controls breathing, speaking, and swallowing. That is why rabies now are very dangerous to all of us, including animals. So, we will share to you several methods on how to prevent rabies infection proposed by Ministry of Health Malaysia.
So I will continue the presentation with the measure of method to prevent the rabies from Ministry of Health. Alright, so for the first step is we need to wash the wound under running water and soap for 15 minutes and then continue to apply an antiseptic. Okay, this kind of measure is under post-loss reduction of risk management technique. Okay, this is because when someone has already been bitten by the animal like dog or else, they need to immediately wash their hand. So it will reduce the infectivity of the virus exposure. Hence, by doing this technique, the loss severity will be reduced. Alright, so for the second method is immediately go to the nearest health clinic or hospital to get the treatment. Okay, this is also related to the first step, which is when someone has been bitten by the animal, they need to wash their wound, then they need to go to the hospital immediately. Okay, this kind of method also under post-loss reduction of risk management technique because they are already being bitten by the animal, right? Then when they go to the health clinic or hospital, it will reduce their pain and also the risk of rabies infection. Okay, this is because when they go to the clinic or hospital, their doctor will give the rabies vaccine or other injection that could be reduce the rabies infection like I said just now. So the loss severity for this case will be reduced.
Now I will presenting about the third methods, which is do not dispose or kill animals that bite or scratch or catch the pet to avoid rabies. The risk management techniques for this method is avoidance. This involves refraining from disposing or killing animals that bite or scratch and not resorting to catching the pet. The primary outcome of this approach is to ensure that no animals will harm or bite others, thereby eliminating the risk of exposure to the rabies virus. By implementing the risk management technique of avoidance, the goal is to eliminate loss exposure associated with rabies. This approach promotes the well-being and safety of both humans and animals by avoiding the transmission of the virus. By maintaining responsible pet ownership practices and avoiding unnecessary harm or disposal of animals, the risk of rabies infection can be effectively mitigated. The next method is report the incident at the nearby district veterinary clinic to monitor the animal for rabies signs. This step is part of the post-loss reduction risk management technique. By promptly reporting the incident to the veterinary clinic, the authorities can take necessary actions to monitor the animal for signs of rabies. This monitoring process involves observing the animal's behavior, looking out for symptoms, and conducting tests to determine if the animal is infected with the rabies virus. This proactive approach aims to identify potential cases of rabies early on and prevent the animal from causing more serious harm to human or other animals. The outcomes of reporting the incidents and monitoring the animal is it reduces the risk of the animal transmitting rabies to others. By closely monitoring the animal's health and behavior, appropriate measures can be implemented to prevent further exposure to the virus. This reduces the potential for additional harm and the spread of the disease within the community. This will contribute to a reduction in the severity of potential losses. By identifying and addressing cases of rabies early on, prompt medical intervention can be provided to individuals who may have been exposed to the animal. By mitigating the severity of potential losses, the impact on individuals' health and well-being is minimized.
The fifth step is, if you have a pet at home, discuss with veterinary doctor the need for anti-rabies vaccination for pets. This method uses the risk management technique of loss prevention. This is because anti-rabies vaccinations help to prevent pets from being infected by rabies virus, so the number of rabies cases will decrease. Or in other words, we can say that the loss frequency will reduce. Next, if pet found to be unwell, we must seek treatment at a veterinary clinic. The technique used in this method is the post-loss reduction. This is because pet already unwell and must get treatment from doctor to reduce their pain and sickness. This is also to reduce the risk of rabies infection that could happen to pets. In this case, the loss severity will reduce. Last but not least, we have to maintain high level of hygiene by frequently washing your hands after contact with any pets. The risk management technique in this method is the loss prevention. This method helps to prevent us from being infected with any virus that could be brought by pets or animals, especially in this case, the rabies virus. So, the outcome by using this method or technique, the number of rabies cases will decrease, or we can say the loss frequency will reduce. So, that's all from us. Thank you.